So hi everyone. Hopefully you've kind of had a bit of an introduction to interviews and what to expect from them. And I will just reiterate what we've said before. At the end, absolutely no question is a silly question. If you're thinking it, probably somebody else is. And we've all been in your position before. And it's so much better that you ask us now than you sit in your interview and think, oh, I'd wish I'd asked that question. So if I say anything today that you think, what on earth is she talking about? Just let me know in the questions at the end. So I'm going to go through some hot topics, hopefully. I was actually, my medical school uses student interviewers. So some of the stations are actually medical students running the station and interviewing the candidates. And I was actually the interviewer for the NHS Hot Topics question this year on my sort of medical school's round of interviews. So I'm going to kind of focus a little bit more on how to answer these questions because I think that was the biggest difference that I saw in candidates was the people who gave really good answers weren't necessarily the people that knew the most about those topics or could quote me the most number of facts. I think the people that actually gave the best answers were kind of more in how they structured and processed it, and you could tell that they really cared about what they were saying. So I'm going to go a little bit through kind of how to do that, and then we'll look at some of the key topics at the end. So NHS Hot Topics questions are all kind of questions that are focused around things that affect patient experiences or affect how we deliver care in the NHS. And they can kind of be divided into three groups. So we've got questions that focus on individuals, questions that focus on systems, and then questions that focus on processes. So for questions that focus on individuals, these are kind of ones that focus on factors that individual people do and how that affects the delivery of care. So we've got a really good example down here. So equality and diversity. It's probably a theme that you've heard sort of around in the news and things like that. But what does it actually mean for patients? So a really great example is a lot of sort of the medical textbooks and websites that we use to learn as medical students still tend to use images of sort of health conditions on white Caucasian male models. And it kind of means that as doctors, quite often we're not very good at recognizing these diseases in other groups of patients. And what does that mean for the patient? That means that person has to stay in pain for longer. Maybe there's more of a delay before they get their treatment. And that all has an impact on that patient process. So that's a really good way to kind of take that really simple idea of equality of diversity and show why it's important to patient care. So if we then take on kind of the systems approach, these are kind of questions that focus on the way that maybe teams operate in the NHS or groups of people or the way that the NHS is kind of structured and managed and things like that. So we could take just a surgical team. We could also take how an entire hospital runs. We could take how entire NHS trusts run or even how sort of the NHS is structured in general. So you might be thinking about things like how the government and politics and economics even kind of come into healthcare and how you can go from that sort of big topic like the government or decisions that the law makes and the impact that has on individual patients and the treatment they receive. And then you can kind of look at processes. So this is a bit more kind of the technical way that healthcare is delivered in the UK. And again, the impact that that has on patients. And I think this one is best described through an example. So a really great example is how a couple of years ago with kind of Brexit, and we're still seeing the same effects now, there was a big kind of hold up in the pharmaceutical industry. So it was really hard to get access to lots of important drugs for patients. And again, if we take that kind of big process, if we take sort of Boris and him sort of deciding on Brexit and things like that, and we take that right down to the patient that's sat in Scunthorpe Hospital, what does that mean to them? It means they're in pain for longer. Maybe their disease can't be managed as well. Maybe they don't get access to, maybe they get access to only kind of the second rate medication that's not as good. And none of that is very nice to experience with a patient. So that's how you can really show that you've got that high level of understanding, that you can take big headlines in the news and show the interviewers what difference, why do patients care about that? Why is that important to patients? So I would say the best way to kind of structure your answer to these questions is to take this really basic structure here. So we've got kind of insight, reflection, and then problem solving. So this insight is actually taking the problem itself and kind of identifying the key aspects to it, what's going on. So if they ask you a question about something, what is that thing? What are the facts about it? And then it's going through that reflective process and actually kind of acknowledging how that thing makes a difference to patients and why that thing has an impact on patients. And then you can start to look towards problem solving. So actually, what can we do about this issue? How could we change something in the NHS that would make a difference to patients? So what are these questions not? And I think this, if you take one thing away from this talk, this is probably the most important thing that I can say. And it's that these questions aren't about sort of factual recall or what facts you can tell me about that thing. So I'll kind of explain this through an example at the bottom because I think it makes a lot more difference, or it makes it easier to understand. So if you were given a question like, what do you know about the Fraser guidelines and Gillick competence? So you might have come across this a little bit in your reading so far. What you're looking to do when you answer this question is briefly kind of summarize some facts, the key headlines, just give that. That's all you need to do. And then you want to actually break it down and think, why are these guidelines in place? Why are they important for patients? What difference has it made having these guidelines in place compared to not having them in place? And why are they important to sort of protect patients? And then you can kind of look to reflect and think, could we have guidelines that are similar to this for other areas of medicine, or could we make these guidelines better, and how would that make a difference to sort of patient outcomes? So yeah, if you take one thing away from this talk, it's not about answering these questions with how many facts can you tell the interviewer, because medical schools can teach you facts and sort of give you the knowledge, but what they're looking for is that you have that higher level of kind of critical thinking and understanding and being able to put the patient first. So some kind of like top tips on how to approach these questions. I think the biggest one and the main one is don't rush your answer. The easiest way to say it, and I think Parveen definitely highlighted this earlier, is they can ask some weird questions in interviews. I think particularly with the hot topics questions, they can kind of take any concept that's maybe been in the news recently, and sometimes they can be quite abstract in the way that they're worded. They can be slightly ambiguous. And you can kind of read them and think, how on earth does this relate to the patient sat in the hospital? But when you get questions like that, just take a few seconds. So kind of leading on to my second point here is medical schools have usually selected that question for a very specific reason, and your job as the interviewee is to work out what that reason is. So just take a few seconds and don't rush into the first thing that comes in your head and then be stuck talking about that topic because you've picked it and now you've got to run with it for the rest of the interview. It can feel like it's really overwhelming to think, oh my gosh, I've got to interpret this question as if it's like a GCSE English exam. But actually, usually, if you think about it for 2 or 3 seconds, you can usually pick up on, they'll usually put quite subtle hints in the question about what they want you to talk about. And it's about taking those few seconds to pick up on those hints. And then if you're struggling with the question, or you just don't know how to answer it, or actually if you just get really good at using this structure, go back to that insight, reflection, and problem solving. So whatever they've asked you about, pick out the key facts, pick out the key reasons why that's really important to patients, reflect on why that makes a difference to patient care and why that's really important to patients, and then maybe suggest a couple of ideas that it could be improved or changed or something else could be made like it. So as I say, I've kind of given you that structure. Just keep going back to that and practicing it as many times as you can. And then also, if you're thinking about other ways that you want to kind of structure your answer or improve your answer, these are really good things that you can relate to. So depending on how and where you kind of are in your interview prep and process, you'll probably have come through or be aware of things like the NHS core values, the NHS constitution, and the NHS 6Cs. They're kind of buzzwords that a lot of the medical schools really pick up on and really like you to mention. I think some people don't like the idea of buzzwords because you're possibly just saying them because that's what they want you to say, not because you necessarily value those things. But just learn them and reflect on them and think about why they're important and why the NHS has chosen those things. They're kind of just bullet point words, so they're not too difficult to learn. I also think a really good one to use in these questions is your going back to your medical ethics and kind of referring to that. So if you're struggling to think about how does this thing impact patients, go through your medical ethics structure because it gives you a really good structure. So you can think about how does this thing affect patients' autonomy, so their right to choose their treatment and be involved in treatment decisions. How does this thing benefit patients? What does it make better for patients? Is there any reason this thing could create harm for patients or be a bad thing for patients? And then justice is kind of like, where does it fit into their rights? Where does it fit into the law? And things like that, possibly some ethical arguments. And then I would also recommend that you have a little look at the GMC Good Medical Practice. It's something that's kind of a hot topic in itself and is just good to be aware of. It's a really long and boring document. So just focus on the highlights of it. And as with any of these sort of hot topics, when you're going through them and practicing, just focus on the real sort of headlines and highlights of those things. Don't go into crazy detail because it's not necessary. And then I would also have a look at this WHO fact sheet. It just relates to some of the sort of rights that people have to health and things like that. And it's just a good thing to comment on. And this kind of summarizes it really nicely and just gives you the headlines that you need to know. Oh, I did not mean to click on that. See if I can get back. Hopefully you can still see my slides there. Okay. So giving you on this slide a list of kind of the main hot topics. As I've already mentioned, really just focus on the highlights. So I think I've put in this box down here, think about how each of these topics you would fit into that insight, reflection, and problem solving structure. And literally just give yourself maybe fold up an A4 piece of paper and use half a side of paper for each of these topics. You don't need to go into any more detail with your prep for that. And it's just my kind of advice and guidance is go to a level that you can just about sort of feel familiar. If I asked you to talk about organ donation, you could give me a couple of arguments for and against. And as long as you can explain those and have an understanding of those, that's more than enough information. There's also a couple of other things to be aware of. So I would have a very sort of brief understanding of how the NHS is structured, what different groups of people work in the NHS, what do they do, why is it important that they're all there? And there's also a couple of case studies that, again, just focus on no more than a couple of sentences, just so that you're aware of what those things are if anyone was to bring them up. I think it's very uncommon that they would specifically quote a case, but it could come up, it could be possible. So just know something about it and just kind of keep aware of the headlines and the news and things like that. And yeah, the practicing structure is just getting really familiar with being uncomfortable. You can practice by yourself, you can practice with friends, you can practice with family. You don't need to necessarily do it in a formal environment, but you can also practice doing things to time. But just get really comfortable with picking up a completely random topic and talking about it. Decide, take a random headline in the news and think, do I agree with this thing? Do I not agree with this? Why do I agree with it? Why do I not agree with it? And just the more things that you can expose yourself to and the more times you can practice using that structure, the better you'll get at answering these questions. And then I've given you sort of a couple of questions to have a practice at by yourself. Again, you can write out answers to these, you can give them to other people and get them to ask you. What you can also do is make your own questions. So use these. I've kind of tried to pick different structured questions, but just slot different words in from that other list that I've given you, and that will give you a whole bank of practice questions. And down here, I've also tried to highlight where those different sort of parts of the structure come in to how you'd answer this question.